So the liver stores and releases blood. It also secretes bile, and the liver generates wind and ensures free flow of blood, energy, and body fluid. Liver controls muscle strength and tension, nourishes and controls tendons. The liver opens to the eye. The sense is sight, secretes tears, nourishes the nails. Associated emotion is anger. The flavor is sour. Energy-giving color is green. Associated season, spring. Climate, wind. The coupled yang organ is gallbladder. So here you could see the different tower diagrams in which you have 3 examples for the yin dominant states and 3 examples for the yang dominant states. And the yin and yang dominant states are balanced. The liver yin stores blood in the vessels and the body. The liver yang releases the blood to the rest of the body when it needs blood for energy, and also releases the blood out of the body in times of bleeding. When liver yin is deficient, it has less capacity to store the blood within the vessels, and therefore, when there is an injury, the patient tends to carry on bleeding as blood coagulation is delayed. You will have no problem recognizing such patients because when you remove their needles at the end of treatment, at least half of the points will be bleeding, and they will continue to ooze blood for a few minutes. It is as if the patient was on anticoagulants. The liver yang releases the blood outwards. In the case of yang excess, there can be spontaneous bleeding. A combination of liver yin deficiency and yang excess is perhaps the worst combination possible, as in the case of liver cirrhosis, as here the patient tends to bleed spontaneously and excessively. When there are signs of blood deficiency, like paleness, tiredness, dizziness, feeling of numbness in the hands and legs, and long menstrual cycles with scanty bleeding in women, this is called liver blood deficiency. It is not necessary that the patient's hemoglobin count should be low to substantiate such a diagnosis. The symptoms are sufficient. In some patients, this could be a temporary state following an accident with much loss of blood or a serious illness or childbirth. The symptoms could improve after a short period of blood building. We can assist blood building by tonifying heart yin and yang, as it is heart that nourishes and synthesizes blood. Excessive and spontaneous bleeding can occur from any organ, but the underlying cause of this bleeding lies in the dysfunction of the liver. When liver has fire heat, that's yin deficiency and yang excess, that makes it release too much blood and store too little. But then, why does the bleeding occur in different organs in different cases? This is because the organ where the bleeding occurs is also in a fire heat condition. So let us now explain what is meant by the term fire heat and why bleeding occurs in these cases. In the case of a balanced organ, if the yang increases in this organ, the organ will react by increasing the yin as well. So this situation is called damp heat, with heat and fluid. This is how the body tries to balance the situation. It reacts with fluid in order to control the yang. This is possible as there is a good amount of fluid in the body. But when there is less fluid, where there is dryness and inflammation or fever, there is not sufficient yin to react with. The only way to balance the situation is by elimination of the heat. And the quickest and most effective way to eliminate heat is to bleed, hence the bleeding. This is not slow bleeding or spotting. It is arterial bleeding, red and fluid, and excessive.